Do you wake up and your low back feels stiff, tight, or even painful? But as you start moving, it slowly gets better. That pattern is extremely common with disc-related low back pain. Today I'll explain why mornings may feel worse and what you can do about it starting now. Hi, I'm Dr. Matt Bradbury, Family Corrective Chiropractor, and this is our practice, One Life Family Chiropractic. Today I'm going to be talking about why your disc pain may feel worse in the morning and what to do about it starting now. In the big picture, here's what happens. Discs rehydrate overnight while you're lying down. This increases internal pressure in the disc, hence more pressure and potentially more sensitivity in the morning. And that's why you may feel more stiff and more vulnerable when you first wake up. So reason number one why the mornings may feel worse is increased disc pressure. More fluid, more pressure, and the spine may be less tolerant to load first thing in the morning. Reason number two, reduced movement. You've been lying still for hours. Muscles and joints stiffen, and the nervous system may be more protective at this point. So some common mistakes in the morning: bending forward right away, aggressive stretching, and or going into periods of long sitting right away. This can increase irritation before the spine is necessarily ready. So here's what to do first. What I want you to do is just focus on walking 5 minutes, helping improve circulation, getting some gentle movement in there, and thinking groceries in, garbage out, as you help with loosening things up. And think about helping to reduce the stiffness and loosen things up so you can start your day at your best. After step number one, I want you to do step number two. And that's going to be some gentle movement of your spine, and I'm going to show you what that looks like right now. This one right here, you can start even by doing this when you get up in your bed. And this one we call the Cat-Camel. And all you're doing is some global flexion extension of your spine, helping to introduce some movement when you're going from 0 to 60 and getting your day started. This one, what I would do, I would focus on 10 to 20 repetitions of that flexion extension to help drive movement and prepare your body for the day. And this next one, just simply doing some gentle pelvic tilts. You'll notice I'm flexing my abdominal muscles, and then I'm extending, cueing my low back muscles, and I'm working back and forth this one 10 to 15 times. And what you can do there, if you find this is really noticeable in the mornings, you can start with 2 rounds of each exercise. You can do the Cat-Camel and then do the pelvic tilts and watch that. And you can see as you get going with your morning routine. And of course, you want to avoid forcing those end ranges aggressively. So you can see I started with some gentle motion, which included some walking, Cat-Camels, and pelvic tilts, which can really be beneficial to help get things warmed up, lubricated, and ready for your day. Step 3, I want you to delay heavy activity right away. And all I mean is by 30 to 60 minutes, take some time, make sure you warm up, drink some water, get moving before you go and aggressively do some heavy lifting, giving yourself those first 30 to 60 minutes to warm up and get your day started. So why this can work really well for you? Well, you're gradually introducing motion, getting your day started, getting those tissues warmed up and helping to improve circulation so you can move and lubricate things rather than just going 0 to 60 as you start your day. And telling your nervous system that, hey, it's safe to move, let's get going and let's get things started. And hey, let's not forget about the health of your spine and nervous system. Many people with disc challenges will seek out corrective chiropractic care. And first, well, guess what? It starts with a proper consultation and biostructural examination to understand what's going on the inside. And many people, well, they have areas they may feel, they also have areas they may have no idea about. And that's why it's so important to get tested to know. And remember, your nervous system controls your body in terms of function and, well, muscles, organs, and helps with your healing. And your corrective chiropractor is looking for a proper spinal motion, but also to understand whether those nerves are irritated and help improve that spinal motion and reduce that nerve irritation so that your body can function and heal at its best. So some things to consider, and this is often the X factor. Many people have been to, well, many places by the time they finally reach these doors and start with a consultation to understand what's going on more. So consider the health of your spine and nervous system and helping you thrive and be more resilient and bounce back that much better, especially if you notice those mornings aren't quite the way you want them to be and you want to live more full out. So thanks so much for tuning in today. I appreciate being a part of your health journey. And remember, start small, be consistent, and I would love to be a part of your health journey some more. So take a moment, make sure you subscribe, like, so we can see more of each other down the road. And as I've shared in the past, I got a big mission in terms of helping people understand their health more. Better spinal health means better health, and more function equals more health. And I simply can't do it alone. So take a moment, if you could. I'd love for you to share this, share it with somebody who you know may benefit, or just to your feed, because you never know who you're going to help and reach out there. I appreciate your consideration very much. Hope you're having a wonderful day. And remember, you're far stronger, more resilient, and resourceful than you may be led to believe. Bye for now.